Welcome. I'm Amanda with KPHA and recently with CPESN Kansas as well too. So we've had a lot going on lately, so I wanted to take a few minutes of your time to lay out some of the opportunities that we newly have in the Kansas area. I know you're aware of what to do by statute, by scope, et cetera, but one of the things that we always want to emphasize is we don't want to see pharmacies doing services that are not sustainable. So really, if you aren't getting paid for it, you shouldn't be doing it. And with that in mind, I really want to walk through some of the current options that are available for all pharmacies as well as CPESN sites too, and reimbursement information where we have that publicly available. So because we'll go fast in recording that for those that can't join us live today, I'll ask that everybody remain on mute until we get to the Q&A. Drop questions into the chat and we'll tackle them during that Q&A time where you can absolutely unmute and ask questions at that time too. And I've got Alex with KPHA helping me man that mute button for a little bit and monitor the chat. She will be dropping links in the chat as we go as well too, so just keep an eye on that. And we will hit the ground running here. Okay, so because I'm mentioning medical billing today, I do want to always show the quick slide on that enrollment process and really what that looks like, because it's way more than just clicking an enroll button. So well beyond the scope of today's program to go into full detail on this, but if you want more information, please hop over to KPHA's Clinical Services resource page. We've added some new resources lately and have a lot of pages of information on credentialing, enrollment, and contracting process. We've got some new resources, including a KMAP portal quick start section. And that includes code and reimbursement cheat sheets, plus a tutorial from CPESN on how to submit claims through KMAP. So if you haven't seen that yet, definitely hop over there. I also just wanted to throw in a few FAQs that we've seen lately, and I can definitely go into more detail on these during the Q&A later as well too. Probably the most common question I've had over the past couple of weeks has been, why are the MCOs asking for a resume or work history from the pharmacists? And that is a requirement for credentialing all medical providers, is they need anywhere from 5 to 10 years of a work history, provided you have that. If you're a recent grad, obviously just the time since your license. But know that because it is a requirement, if you've got it from one, you'll get it from the other two. But if you create a CQH profile, it definitely takes time up front, but because plans can access that and it includes your work history, it saves you the time of responding, well, creating a resume too, if you don't have one already, but it saves you the time of responding to all MCOs. It also maintains your license up to date as well too. So if you get a new license renewed, et cetera, you don't have to send that to all of the plans you're contracted with because they can just access CAQH and go from there. So if you want to skip that step, get that CAQH profile completed and keep that up to date. I've had quite a few people ask what you should charge for immunizations. And obviously that's not something I'm going to tell you. But I will say charge what your usual and customary is when you enter that in. It should be the same across the board for all insurances anyways. And so make it the same for your medical billing as well too. Just know that for Kansas Medicaid, there is a contracted statewide rate that all providers receive the same for immunizations. So that's the rate that you will be paid. So don't charge exactly that, but just know that that is what you will be paid by Kansas Medicaid. We are switching MCOs at the end of this calendar year. Aetna is going away, and a lot of people still haven't made it all the way through the contracting process yet. And because of this, Aetna is just looking to go ahead and bill and go ahead and pay all providers, regardless of that contracting status. As long as you are in KMAP, even if you haven't signed documents with Aetna yet, just bill those claims now so that they're in the system and they can be paid. So that's the advice, is whether it's through the KMAP portal, whether it's through electronic billing, we strongly recommend getting those billed now. And then the other thing related to Aetna's departure is Healthy Blue / Elevance will be coming in as our new MCO at the end of this year. Beginning of next. We're currently waiting to see what they're going to do as far as enrollment processes. They told us at first that they would be reaching out to folks via email. It's looking now like you may have to go into KMAP and actually click a button to say you want to enroll in Healthy Blue. I will say that there are mandatory provided trainings taking place now through January that will be a requirement for participating in their network. They'll send out a calendar invite once you register, and Alex will drop that into the chat, a file into the chat that has the registration dates and times on there. So they'll get you into that Teams meeting. They'll send you a calendar invite for 2 hours. It took me about 30 minutes to do that required provider training today. So they're just going through some basics about like who to contact for X, Y, Z. So just so you know, again, every provider, physicians, nurses, et cetera, that's going to be billing in their system has to go through this. So it is just a part of their process, and we will send out more information via email as soon as we know exactly how to get contracted. Just a quick reference on the statutory services, since we are reaching the end of this calendar year, and we do not believe that the PrEP Act is going to be extended, obviously we still have our statewide protocol for flu, strep A, and uncomplicated UTI. But the PrEP Act is what covers pharmacists for doing COVID testing, and especially COVID test and treat services. So just keep an eye on that, that is something that's going away. We've been told that the state is allowing folks to continue testing in pharmacies, but we're clarifying how that's going to work. So just as an FYI on that. Diabetes services. So not a ton new here, but I do want to point out that we do have our that Medicare Part B services. You can go through one of two processes. One of them is actually going through the full accreditation process, but you also have the option to affiliate under an umbrella provider. That is up and running. We do have 2 pharmacies that are ready to go with that starting in 2025. There is a cut off the top, of course, as they help you, basically vouch for you and bill those services for you. But it is an option to get you up and running with diabetes prevention program classes sooner. One grant opportunity I do want to talk about now is our opportunities for pharmacy technicians to train as community health workers. This is a slightly over 100-hour certification course, most of which is home study and a few live classes. And then about 40 some hours are actually project-based, to where you're investigating resources in your own community and building a resource book for your pharmacy to be able to, or your site to be able to send out referrals for. So the focus for this is really making sure that we are, improving individual health and well-being, but also making sure that everybody has access to resources that they're entitled to as well. So looking for, food insecurity referrals to maybe if you don't have a diabetes prevention program, referral to somebody else's diabetes prevention program, those type of services and outreach. But also documenting when you're helping folks with things like helping them get cheaper medications too. So the grant opportunity right now is going to cover technician time to take at least the home study section of the course, the cost to actually take the course, and provide a training stipend for the pharmacy as well too, because we do want to make sure that, again, those referrals in your community are being documented through an e-referral service. So right now that is open to 10 pharmacies in the state, and the deadline to apply for that is going to be this Saturday, December 7th. And Alex will drop the link to that in the chat. Hopefully we can get, we really want to see pharmacies from across the state applying for this. And the good news is that we are expecting this to be a renewable grant. So if you don't get into that first 10, we are hoping to restart this with the next cohort in the late summer, early fall too. So really excited about that project. The next opportunity we have right now is going to be our vaccine gap closure project. If you've worked with Missouri Pharmacy Association at all, this is a project that they've been working on now for about 2 years or so. And so we're actually really hoping to duplicate their project fairly closely because it has been so successful. The nice thing about this is it does utilize both the technician and the pharmacist to do follow-up with the patient as well as administration or counseling when it comes to vaccine hesitancy, or maybe any access factors when it comes to getting vaccinations done and taken care of. This is one where the opportunities are open to every pharmacy in the state, but pharmacies will be required to enroll in CPESN and CPESN Health Equity because they will be the ones administering this program for us. They have a lot more experience than KPHA does in documentation and analysis of this type of data. And so we're really excited to be working with them for the first time on this too. So we are not requiring community health worker training for this, although if you have a community health worker on staff, that is a bonus for your site. You will, if you don't have that community health worker on site, be required to undergo, I think it's a 4-hour social determinants of health specialist training that is provided at no cost to you other than the enrollment in CPESN Health Equity. So with this one, there will be a fee for service, so paying for each intervention that you have with the patients, as well as training stipend for the pharmacy itself. So Alex will drop the information for more information on either of those grants. Please do check out the link. So you'll find out more information about the grants, as well as the site to sign up for those. So again, deadline for this one is also Saturday, December 7th. We will be hopefully taking a look at the applications next week and notifying pharmacies within the next probably 2 weeks or so, hoping to get that done ahead of the holidays, as these projects will likely start at the beginning of the year. So I did mention this is kind of a crossover here, CPESN Kansas. Quick reminder that CPESN is open to all pharmacies in the state that are capable of performing the core service sets required for CPESN. And then another requirement that we will start enforcing at the beginning of the year will be pharmacies will need a membership with KPHA because those organizations are now related. So the nice thing about that is it will cover all pharmacists and technicians at a particular site. Some of the things that we have going on right now, one thing that we mentioned at our last clinical service overview was our vaccination clinics. This was a super exciting program. It had been running for close to a year or so, but we'd been doing it on a by referral basis. And the last about 35, 40 days of it, they allowed pharmacies to self-refer facilities. And in that October 2024 timeframe, 35 pharmacies participated, completed over 90 clinics. So most pharmacies did a couple each, and administered over 5,500 vaccinations with over $80,000 that will be paid out to pharmacies. So really excited for those pharmacies and the time that they took to take care of their communities there. So I'm very excited about that. And I wanted to share that out for everybody, just kind of as a reminder of, sometimes these are pretty last minute opportunities, but they can be very helpful for both your community and your pharmacy. Another one I just wanted to very briefly mention is we've got some pharmacies starting our Flip the Pharmacy Transformation Coaching Project to really work on the implementation of medical billing in their sites. The pharmacies are getting paid incentives to meet performance goals, such as getting registered or submitting their first bill. 19 pharmacies will be starting this project February 1st. So we're really excited about that. Coming soon. And so hopefully you have heard of this project. There is still time to sign up for this health risk patient screening project. This is basically a fee for service project that will work with 2 of the 3 state MCOs. This is a pharmacy technician-led program. So for those of you that are like running short on pharmacist time, but I've got some awesome technicians, this would be a great program for you. They will be working with the patients to survey them for health risks. The health plans are providing the target patient list. So making sure that you're surveying those that they're identifying. And at least one of the 2 of them is going to provide tablets to the pharmacy to help make that happen. So you can, call it up on the tablet, hand the tablet to the patient, and the patient can walk through it on their own. These projects will be starting early 2025. So make sure that you get registered for that. Again, Alex has dropped that into the chat for getting registered for that health risk screening. Pharmacy Care Hub is another one that will start early 2025. This is one we chatted briefly about last time, and there is still opportunities in some areas of the state to get signed up. So Alex will drop that application in the chat as well too. So what this does is provide a tablet to the pharmacy that has a telehealth connection app on it. So it can be used for a number of different things, whether it is a patient that has just struggled to get in to see their diabetes care provider, and maybe they just need a refill on their metformin for a month or two until they can get into their regular endocrinologist or primary care provider. Or it could be an acute care something. If somebody's got a weird looking rash, and it's a Saturday afternoon, you can help them out by doing that telehealth connection and get paid for that telehealth connection. The other thing that can happen as a part of that telehealth connection is your pharmacy can get paid for assessment of the patient. So whether it's a blood pressure or test to treat services, that can be a part of that telehealth site visit. So that's a pretty cool thing. If you do not want that telehealth connections piece of it, but you would still like to get paid for pharmacy services such as medication therapy management that's self-identified, or test to treat services for this Medicaid population, the pharmacy can also get paid for that as well too. So pretty excited about that project. It's implemented in 4 states already and is going pretty well. So we will be the 5th state to roll that out in early 2025. So more information is coming soon. Existing CPESN sites, will get some more information on that in the newsletter coming out later this week. So with that, I will finally mention that if you want to do more with your license or get paid for the things that you want to be doing, we need to break even on the medications that go out the doors of our community pharmacies and our hospital too. So we want to make sure that you're telling those people that represent you at the Kansas State House at our KPHA Advocacy Day in 2025. If you've never done this before, we encourage you to check out the website that Alex is going to drop into the chat here for more information. We're going to be adding some short introductory videos coming soon. We will have a training on the morning of Advocacy Day, but also a Q&A session hosted at the end of January too. So, one of the things I always kind of like to share is if you're not at the table, somebody else is making decisions on your behalf. And you don't really want the only message that your representative hears to be that pharmacists are all living rich and happy while rising healthcare costs for everybody else. So we strongly, strongly encourage you, if at all possible, to attend KPHA's Advocacy Day, February 5th, 2025. So with that, I will open it up to any questions that folks may have about these projects.